Governor Pritzker's five-phase plan to gradually reopen the state is already getting pushback. Some Republican state lawmakers say the governor's approach to restarting economic activity is too slow and criticize him for failing to involve them. But Pritzker says he is being led by the public health experts and the data, and he insists he will not reopen the state prematurely. Joining us to share their thoughts are State Representative Michael Zaleski. He's a Democrat from Riverside who represents the 23rd District, and State Representative Deanne Mazzochi, a Republican from Elmhurst, who represents the 47th District. And thank you both for joining us. Before we get started, let's briefly review the governor's plan. Phase one of the Restore Illinois plan is the rapid spread stay-at-home policy for all non-essential workers, social distancing from anyone you don't live with, especially vulnerable friends and family members. Phase two, the flattening phase, which is what the state is in now. Stay at home as much as possible. Non-essential workers must still work from home. People must wear a face covering when outside their home. Phase three, recovery. The share of people testing positive for the virus would have to be at or under 20% and increase no more than 10 percentage points over a 14-day period. Phase four, revitalization. To move to phase four, a region must have virus testing available to anyone, regardless of symptoms or risk factors. And phase five, Illinois Restored, would be a full reopening of the state's economy, and this is only possible when vaccine or effective treatment are widely available. And Illinois has 4 COVID-19 regions. Each region would be able to move through the phases of the reopening process independent of the others, depending on their particular situation. Regions can progress through the recovery phases as the situation improves, but can also go back a phase if the situation in that region deteriorates. So that's a big picture overlook. And Representative Mazzochi, what is your assessment of the governor's plans?
My assessment of the governor's plan is that it's not particularly workable and it's very arbitrary. And I think that that's one of the reasons why you're seeing opposition to it. And by the way, that opposition isn't just from the Republican Party. It's also coming from some of the Democrats as well.
And Michael Zaleski, criticism that the governor's plan is too cautious, that it moves too quickly. Is it too cautious?
Well, Phil, the governor said at the beginning of this, success looks like an overreaction. I think as long as we listen to health experts and epidemiologists, which this plan is based on science, the health and welfare of our citizens takes priority. And as of right now, we're in a place where we're going to try to get to phase three by May 29th and see what happens. I think it's a well thought out plan based in science, and that's the most important thing.
Deanne Mazzochi, based in science, and therefore science should take precedence. Yes or no?
It's absolutely not based on science, actually. And as a clear example of that, you can look at what the governor has said is going to be his threshold for Illinois restored. He said that he's only going to restore Illinois back to normal if we have a fully effective vaccine or a highly effective treatment. And as someone who has actually worked in the area relating to pharmaceutical development for over 20 years, the idea that everyone in the state of Illinois is going to agree to stay on lockdown for the next year, 2 years, 3 years, possibly even forever is not a scientific plan. That's a wish list. The other thing that is very concerning is that while the governor keeps coming out with all these various iterations of plans, as we've seen for a lot of these so-called plans and promises that he's come out with, he hasn't actually executed and delivered on some of the things that the state already is supposed to do. We see this with IDES. He's been promising contact tracing for over a month. That hasn't happened. So, you know, there's a lot of concern that the governor is saying a lot of things. He's promising that he's basing his decisions on science and data, but in reality, that's not actually matching up.
Michael Zaleski, the Chicago Tribune, accused the governor of moving the goalposts. And as to the criteria for phase five, which is reopening, restoring Illinois, is that unrealistic in that there's an expectation that there be a vaccine or effective treatment? Is that too strict?
No, only because already the federal government has started shipping remdesivir to hospitals to help with mitigating the spread and treatment of the disease. We've seen various companies trying to develop a vaccine as fast as they possibly can. Phase 5 is the ultimate goal, and it's taking far too long. I think the governor would admit that. I think everyone in their right mind would say this is simply excruciating for everyone to get through. However, if we don't take our time and try to mitigate the spread of the disease as much as possible, we're going to be right back to where we started in the beginning, which is an overworked healthcare system, overburdened frontline workers, and an inadequate response to try to contain the disease. We have to stay on the course. We have to go into phase 3, continue what we've been doing as far as physical distancing, continue what we've been doing as far as mitigation of germ spreading. If we start to move in a direction where we see real effect, I think the governor and others will say, then, you know what, we're doing the right thing, and gradually our economy can start to reopen.
Deanne Mazzochi, you have accused the governor of acting unilaterally. How transparent has this process been, which has led up to the creation of this plan?
It's been the antithesis of transparent. He did not involve stakeholders. And again, one of the things that I've been pointing out is that if in fact this plan really is so fantastic and really does have the support of people on both sides of the aisle, then there shouldn't be any difficulty in having the members of the General Assembly go down to Springfield, vote on the plan, and say, yes, this is what we're going to do. And then you can have all the legislators being accountable for saying, this is what we agreed to, and this is the lack of oversight that we think the governor should be allowed to have, with no timetable for the next year, 2 years, possibly even forever in sight. And that's not really something that the people of the state of Illinois signed up for. That's not how our government is structured. So yes, he has been acting unilaterally. And, if he wants to start getting back to not behaving unilaterally, he should let the legislature come back down to Springfield. We should do our job and make sure that we actually are focusing on what the people of the state of Illinois need before we get to a point where the state goes down into a death spiral that we simply can't recover from.
Michael Zaleski, how about it? Should the legislature convene in Springfield and give the governor's plan a thumbs up or a thumbs down?
Well, my expectation is the General Assembly will convene. It'll be in a time and period when we can deem it safe, when the Illinois Department of Public Health can deem it safe for both legislators, staff, and the general public to be in a congregate setting. It's important to remember, Phil, when we go to Springfield, we bring a lot of people with us. We bring advocates, we bring lobbyists, we bring a concentrated mass of people. We have to keep everybody safe. We have an Emergency Health Act. We have an Emergency Powers Act. We have a Public Health Act that the governor has been operating under. But at the end of the day, I think in the near future, we'll be back in Springfield to work on budgetary issues, COVID relief, and we'll do it in a safe way that both public health experts and epidemiologists approve of.
Deanne Mazzochi, we're almost out of time, but I'll give you the final opportunity. What do you want the public to keep in mind as this goes forward?
I want the public to keep in mind that we are trying to actually keep people safe, but we're also trying to make sure that the state of Illinois doesn't get destroyed in the process. And that's the big problem that I see with the governor's plan, is that by not making the General Assembly get back to work, do our job, make sure that the state is actually on track and functioning, which we can do in a safe way, because contrary to what Representative Zaleski said, there is actual IDPH guidance on how we can get back to work in Springfield without having to violate social distance norms. We should do that, get our job done. We're certainly getting paid, so there's no reason why people who have managed to go out there and work in grocery stores, they're working minimum wage jobs, they're doing the work that we need to be essential to keep our civilization running. There's absolutely no reason why the General Assembly can't get back to work in Springfield.
Deanne Mazzochi, Michael Zaleski, thank you both for joining us. We very much appreciate it.
Thank you.